One of the things I think is really important for all of us to be able to do is to figure out when we see a headline, when we start seeing something enter the discussion and get repeated over and over again, and it's a major claim, we need to be able to figure out for ourselves, is it backed by evidence or is this disinformation or misinformation? And we have the perfect example today. There's a new I'm going to use some of the words they're using, even though they're BS, quite frankly. There's a new quote study about COVID vaccines from quote Florida floating around, which I started seeing over the weekend during my live streams. I saw some of the people in the chat saying, David, new study from Florida says that COVID vaccines increase heart attacks by 84% in the month after one is vaccinated. When you get a vaccine, your odds of a heart attack go up 84% for the month after you've received that vaccine. So the first question with all of these things is, does it pass the sniff test? So with some of these things, it turns out we don't breathe oxygen. We actually breathe really light water. So I don't know. We would say this doesn't even pass the sniff test. It's not really even worth looking into. Now, let's imagine it were true that getting a COVID vaccine increases your chances of a heart attack by 84%. We would be talking about so many heart attacks and deaths that we would have heard about this more quickly than 2 years into vaccination. But let's imagine that we want to take this seriously and explore it. The source of this is Florida's Surgeon General Joseph Ladapo, a known anti-vaccine voice. And Ars Technica has a really good write-up about the so-called analysis. And he put out a statement on Friday that men age 18 to 39 should not get the COVID vaccine. Why not? Well, he claims to have an analysis called Exploring the Relationship Between All-Cause and Cardiac-Related Mortality Following COVID-19 Vaccination or Infection in Florida Residents, a self-controlled case series study. There is then a press release about the analysis. So now we're like a layer removed. Now it's a press release about an analysis. The press release says COVID vaccines cause an 84% increase in the relative incidence of cardiac-related death among males 18 to 39 within 28 days following mRNA vaccination. There's a lot of important data in that claim, or important metrics in that claim, which we are going to look at. So let's take a look at the analysis. One of the things you might notice when you pull up the analysis is it's supposedly from the Florida Department of Health, but it's not on Florida Department of Health letterhead. That's sort of weird for an analysis supposedly from the Florida Department of Health. There's no authors listed on the study. Well, that's really weird. And of course, it's not peer reviewed. Obviously, I mean, there's not even a claim that it is or that it's in any journal or that it's been reviewed in any way. So what is the analysis that has been done? Well, the first thing is they did what's called a self-controlled case series. We're going to talk about what that is. How should we look at vaccine safety? You would want to take a group of vaccinated people and a group of not vaccinated people. Maybe they get a placebo, the non-vaccinated people, so no one even knows whether they are or aren't vaccinated. You match them up demographically so that in both of these groups you have similar underlying health statuses, other parameters, age, etc., and you compare them over a period of time. Which of the groups over a period of time, the vaccinated or unvaccinated group, has more infections or more cancer or more car accidents, whatever. And the idea is you want to make vaccination the only variable. One group has the vaccine, the other doesn't, and they are otherwise identical groups. In a self-controlled case series, which is what was done, there's no control group. The only people in their study are the people that are being studied and whose outcomes are being measured. There's no control group. It's, you got a COVID vaccine, died within 25 weeks, and then they look subsequently at the group that died within the first 4 weeks. And what they wanted to see was, are the deaths clustered in the first 4 weeks after the vaccination, which is considered the risk period for a vaccine during which a side effect or a complication could happen. And so they look at the first 4 weeks, and then they call weeks 5 to 25 the control group. That doesn't make sense. That's not good science. And I'm getting so wound up that I punched my microphone. Now, what they also did was they excluded people from the study who had COVID, died of COVID, and they excluded people with boosters. Why would you do that? Wait a second. You want to study something related to COVID and the vaccine. You have no control group, and you exclude people from the study who had COVID, died of COVID, or had a booster, meaning they went beyond their first 2-dose regimen. Well, that's nonsense. That doesn't make sense. They also don't actually have any medical information for cause of death. They only have death certificates. And as we know, death certificates, through no deliberate attempt at fraud, don't always represent the heart of the matter, for lack of a better term, about how someone died. Sometimes you die because of a complication from COVID. That complication goes on the birth certificate, but not the fact that you had COVID and the reason you were in the hospital was COVID and then a complication came up, just as one example. They don't know how many people died of undocumented COVID cases after one dose of the vaccine, for example, where one dose of the vaccine is not considered that you are protected. That's not actually a full regimen. Even the cardiac-related causes of death might not be. The analysis says in it, quote, cardiac-related deaths were ascertained if a code of I3152 was on the death certificate. Thus, the underlying cause of death may not be cardiac-related. They're even saying some of these cardiac-related deaths might not really be cardiac-related. They also didn't separate out people with mRNA vaccines and non-mRNA in a clean-cut way. They claim to be studying the effects of mRNA vaccines. Remember, the Johnson & Johnson vaccine is not an mRNA vaccine. They have two classifications. They have people with an mRNA vaccine and people with a non-mRNA or unknown type of vaccine. You could have obvious misclassification when those are your categories. And it also only looked at men 18 to 39. Now, there's two important things about that. First of all, they combined 18 to 24 and 25 to 39. Why would they do that? When the underlying data separates those into two groups, 18 to 24, 25 to 39, why would you combine them? Well, they don't say, and of course the speculation is that by combining those two groups, you get them the finding that they wanted. This is a version of what's called p-hacking, Google p-hacking, and you'll very quickly learn what that is. Last thing, the number of deaths in the specific group they studied was 20 during the first 4 weeks, and then 52 in the so-called control period, 5 to 25 weeks. And the sample sizes are so small, and it's not really a control group, that the data are essentially meaningless. So don't fall for it. Joseph Ladapo should be more concerned with disease outbreak in Florida following the hurricane and power outages, which is a real issue after a natural disaster, than putting together these bogus so-called analyses, messing with the data, no control group, wrong type of study, on and on and on. So when you see the headline now, vaccines cause 84% increase in cardiac death, you now are equipped to understand that the so-called analysis is completely bogus. Something in your home that you use every day contributes to deforestation and climate change, and that's toilet paper. In the US alone, over 30 million trees each year are required to meet toilet paper demands, contributing to deforestation, soil erosion, devastating loss of biodiversity. Our sponsor, Real Paper, makes sustainable toilet paper that is 100% made from bamboo. A bamboo stock keeps growing. It can be harvested forever. It means that the soil and the ecosystem aren't disrupted. No carbon removing trees are cut down. The paper industry has a massive effect on deforestation and climate change, but you alone using bamboo toilet paper can make a positive impact, because for the toilet paper that just one American uses in their lifetime, hundreds of trees are required. Put an end to that right now with real paper. The best part is the stuff is really great. It's just normal soft toilet paper. Real Paper loves the David Pakman Show. They're giving my audience 30% off your first order and free shipping. When you go to realpaper.com/Pakman and use the code Pakman at checkout, the link is down below.